right? We cannot erase the grief of that loss, but there are things that we can do that helps to process, gives permission to grieve, and actually brings families closer together rather than pulling them apart.
Welcome back to Caring for Both, a curbside consult series by the American Association of Pro-Life OBGYNs. I'm Dr. Christina Francis, back again for the second episode in our discussion with Dr. Michaelene Fredenburg. Today will be continuing our discussion on reproductive grief care, focusing on a really exciting continuing education program that was developed by Dr. Fredenburg to help emergency department staff and physicians better address the emotional and grief aspects of pregnancy loss as they treat patients that are facing this tragic situation. And as we said in the last episode, we know that the emergency department oftentimes is the entry point for women and families that are experiencing reproductive loss. So Dr. Fredenburg, thank you so much for joining us again this week on the podcast.
Thanks for having me back.
Absolutely. So I'm excited to have you tell everybody more about this emergency department project. How did you come to recognize the need for a program specific to the emergency department like this?
Well, certainly, as we were thinking as a team and looking at, right, the need is vast right now when it comes to reproductive grief care. There are not many organizations that focus on it. And you have to make decisions. Where are you going to put most of your time? So we're saying, well, where's the place of greatest need? And one of them that we had quickly discovered was certainly in the emergency department. So of the approximately 1 million miscarriages that occur every year, 50 to 70% are going to encounter the emergency department. And emergency department staff, by and large, have received no training about the emotional or grief aspects. And obviously, it's fast-paced, it's chaotic. And when you think of emergencies, typically a miscarriage doesn't, it's not going to be ahead of others, but it's an emotional emergency that really needs some tender care. And we could see that as a place where what happens there could either help to set that patient and her partner and their family on a healthy grieving trajectory, or it could create additional trauma, which is what we were viewing and thought we could do something about this.
Yeah, absolutely. Well, and I think, as you said, many times the staff, and again, as you referenced in the first episode of this podcast, us talking about this is not meant to play the blame game or, be incriminating for anyone. Certainly, going through an OBGYN residency, I don't even feel like I got enough training on how to manage this situation well from an emotional and a mental health standpoint. So certainly someone who is working in an emergency department gets even less. Before we talk about, how you're trying to change how this is dealt with, what are some of the major mistakes that you have either heard of or been told about emergency department staff making when caring for patients? We talked about some of these, I think, that we all make in the first episode, but specifically in the emergency department, as you said, it's fast-paced, it's chaotic. They have to triage patients based on their medical acuity. And so oftentimes I'm sure the mental health acuity, comes secondary to that. So what are some things that you see that we need to be fixing as medical professionals?
Well, certainly there's language. So any statements that are minimizing the experience and the loss that is occurring, also either excluding the partner or just not acknowledging the loss that's there. So for that person and not preparing them as a couple, and there's simple things that can be said for grief education. But we also see two other places of trauma are not adequately preparing them for any sort of dignified retrieval of the remains. So they're often sent home to finish the miscarriage with no way to collect the remains without instructions about how to do that. And we see that in research study after research study, how traumatizing that is for the individuals. And not only at the time, but then later, which really then moves into memorialization. There isn't a thought of a way to memorialize this loss. And all of this is really understandable, and in fact doesn't often fit into the competency of the people who are there to care for them, which is a big reason why we teach multidisciplinary teams and really urge that the social worker and the hospital chaplain is involved in the process.
That's amazing. Well, and I think too, I've thought about at my own hospital, of course, we have many of our labor and delivery nurses have been through training programs, Resolve Through Sharing and some other programs to learn how to take care of families that are going through a loss. But usually, again, those are farther along in the pregnancy, typically, second and third trimester. But we have so many resources there for these families to have mementos of their baby, amazing 3D printing that can be done, and all of these really amazing things that can be done so that they can have a memento of their child. And yet those resources are not oftentimes available in the emergency department for women who are coming through there. And so there really is a need to increase not only the sensitivity of people in the emergency department taking care of these patients, but also the resources that we make available for them. You've already touched on this a little bit, but is there any other advice that you would have for emergency department staff, whether it be the nurse or the person just rooming the patient or the emergency room physician or physician's assistant, as they care for patients facing ectopic pregnancies and miscarriages, especially because I think for many of them, this is something that maybe they feel a little uncomfortable handling the emotional and mental health aspects of this. So what would be just some, bullet point advice that would be teasers for people then to bring this training program to their hospital?
And I do want to mention, I've been saying, trauma to the patient, trauma to their partner. This is traumatizing for the helpers as well. And we see that, and there's a number of studies showing that this contributes specifically to compassion fatigue and vicarious trauma for nurses in the emergency department. So they feel they're unequipped and they feel that they're missing the mark. They don't know what to do. And so actually a big part of what I think our training does is actually provides confidence that, yes, you are there for many people, this is like the worst moment for them. So you're not going to see a beautiful ending, but the things that you do and say actually will create that for them, right? We cannot erase the grief of that loss, but there are things that we can do that helps to process, gives permission to grieve, and actually brings families closer together rather than pulling them apart. So I think you said just a couple things in addition to that, really thinking of working as teams so that it literally starts with registration. And so part of our training is that they're trained as well on what they do. And in fact, for a couple of the systems we're working with, not only does the person at registration know some things to say or do that would be a little bit different, but they immediately contact the social worker or chaplain and see if they can come sit with them in the waiting room. And so this already starts a process for them where you're already beginning to care for the emotional needs of that patient. And then also having a system in place so that you're immediately marking the chart or whichever way that you're communicating, so that the patient or their partner doesn't have to repeat over and over and over and over again to each individual that they're seeing, and that there's some sort of warm handoff that is occurring. And then we do provide instruction on there's simple things that are already available in the emergency department for a miscarriage collection kit that's available for them, and then get that chaplain involved to be able to speak about memorialization.
Yeah, that's wonderful. Well, and again, at some of the hospitals that I've worked at, I love that as you said, it's everybody on the team working together as a team. I think sometimes there's an assumption that a hospital chaplain would automatically know how to deal with
Yeah.
this situation because they're a chaplain. And again, not knocking the chaplains that I've worked with. I mean, they're human beings just like us, and that's probably not a normal part of pastoral training necessarily to understand all of these aspects of taking care of women in these situations. And so I just think that's so wonderful that it pulls in every member. And I have felt bad in the past when I've asked a patient when I know they've probably had to tell their story, 4 or 5 times, but maybe there's a piece of information that I don't have that I really need to have. And, but that they
Yes.
probably have told their story already multiple times before you're seeing them. And so I just think that's really wonderful to think about from the very first moment they show up to the registration desk about that.
And then definitely taking those patient cues, right? So if the patient is describing that they're losing their baby, then we should be saying baby. But if they're referring to
Oh,
pregnancy or
yeah.
something else, like we want to make sure that we're honoring and respecting that. And I think in every
Sure.
situation, again, right, everyone's experience is going to be unique. Their cultural, religious
Hmm.
background may also mean that their preferences are different. And so, not being afraid to
Sure.
ask questions. I mean, literally just asking,
Mm.
how would you like me to blank? Or are there religious
Yeah.
or cultural practices that I should be aware of? So I think the more that we
Mm.
can ask and allow the patient
Yeah.
to actually lead us through, the better. We don't need to know it all, and we're never going to be able to put ourselves in their place, but they can actually educate
Sure.
us. And in doing that, that really helps that process for them as well.
Hmm. That's such a good reminder, and actually something on the cultural and religious aspect that honestly I haven't thought about doing in the past. It's so yeah, and so but as you said, that will give us cues of where to go next with that patient and how to best support them and ensure that they have the care that they need. Can you tell us, so can you describe just briefly how long does the training take? If let's say we've got a physician who, like me, is listening to this and thinking, man, my hospital needs
Right,
this. Can you tell us first, what sort of time frame are we
right.
looking at there for a hospital system? And then if somebody wants you to come do this training at their hospital system, what would be the process of getting that
Right.
started?
And certainly, so we have, you can get the full menu, right? We actually call it transforming reproductive grief care in the emergency department. But not every healthcare system is ready to do that, for a variety of reasons. And so for some, they're going to choose, they're going to say, okay, we want to assign everybody to take the 2 hour on-demand course that we have. And that's a great
Right.
step in the right direction to be able to do that. And we also, we'll do grand rounds, a 1 hour grand rounds for physicians. And so that's sometimes a place where people go and they can actually license our courses, which makes it really easy because they can set it right on their hospital system and assign those courses out, which we've been hearing has been something
Amazing.
that's worked really well for them. But for someone who wants to do the entire process, our team actually will do a gap analysis and then make policies and procedures, best practices, recommendations. And so we would definitely need to be working with someone who is in a position of authority within that emergency
Hmm.
department. From there, we actually do an intensive half-day training for a team, and that would be multidisciplinary, where we're actually teaching them what I described. We call it the chain of compassionate response. So we're providing them with the research and the best practices and then saying, okay, how do we do this together? And let's practice this together. And that includes bad
Hmm.
news delivery. And it's so everywhere from check in through discharge for them. And then the rest of the staff would be assigned those on demand courses. That seems to be a way, right? We want
Okay.
to look at sustainability. If you're going to put time into this
Hmm.
project, let's make sure that this is something that can move forward with it. And then we typically will engage with the team be available for them for another 6 to 12 months, just to answer questions, or if they run into what they're thinking is a hiccup, and to do some assessment
Mhm.
with them as well.
That's amazing. And I assume we're going to get into your website towards
Right.
the end, and we'll make sure that we have that available for people. But if someone is listening to this and they want their hospital system to do one of those trainings that you
Mhm.
were just talking about, can they reach out through your website?
Absolutely. Yes. And I would encourage them to. So we do have, for the emergency care program, there's actually a special place on our website. They can go and read a little bit more about that and then reach out to us. And then we can talk with them and really assess like what's the best level of engagement. I know sometimes people want everything, but it's not practical. So let's start with something. And then we also have some very specific courses as well that they might be interested in, that they can go and look through our learning management system and take advantage of.
So wonderful. I'm hoping that many people who are listening to this will consider at least one of those modes of training for their hospital, because I'm sure that just based on my own experience and people that I've talked to, and I'm sure based on yours, that at least the vast majority of hospitals in this country could be doing better with supporting
Yeah,
women
absolutely.
in the
Well, and
emergency
because
department.
we don't have training, and it hasn't been the standard of care. And so we're kind of
Right.
all starting there together from the handful of systems that we've worked with. It's been really for us to hear they've said things like, this is transforming care for reproductive grief care. And they're like, but even care beyond that, because we've learned to work together as a
Wow.
team.
Mhm.
What did someone say to me? They said it's reigniting our compassion. Um, and then
Ah,
something that really I was really interesting is that one of the heads of the emergency department said to me, he said, whole person care is the buzzword now. It was whole person care.
mhm.
He said, in fact, our hospital like has billboards up that says we provide whole person care. And he said, but no one's taught us what that means or how to do it.
Mm,
And he said, you're the
right.
first organization
Yeah.
that did. And we now feel like we're actually fulfilling that, which actually is really
Yeah.
wonderful to think of, not only that enhanced patient care, but to know that the actual providers and helpers themselves are again kind of feeling that kind of bringing this together for them. We love to hear that, and self-care is a big part of our program. It's required for those who go through the longer program.
Amazing. That's amazing. Well, and as you said, obviously our goal is not just that our patients um, survive, physically traumatic experiences, but also that they would
Yes.
flourish. And I think that this is a way of trying to ensure that our patients can still
Yes.
flourish despite going through a very tragic situation. And that, I think we're in this mental health epidemic in this country that, and it's so difficult. I know it's so difficult to find a mental health professional to care for my patient because we're so shorthanded on that. But this would be potentially a preventative measure that
Absolutely.
we can do to prevent a mental health disorder. And there's just not very many times when we have the opportunity to intervene and do that. As well as you said, I think for a lot of us who are practicing medicine, there's been so many changes within medicine that really have sucked the compassion and the joy, honestly, out of our profession for so many of us. And so something that can help restore that and help us understand again why we went into this profession is
Yeah,
really amazing.
absolutely. Right. And we can't create more time, but we can learn how to use our time a little bit differently. And certainly a team
Mhm.
approach helps that as well. And then what a beautiful gift it is to the patients to acknowledge their loss, give them permission to grieve, and provide ways for them to have a meaningful connection with their child that
Mhm.
we know through research is going to make it more likely that that relationship remains strong and together. And as you said, that that family and
Mhm.
the individuals in time will flourish as they work through the grieving process.
Absolutely. Absolutely. So beautifully said, Michaelene. As we wrap up, the last thing I want to ask you is, other than this emergency department program that you all offer, what are one or two of you guys have many amazing resources, but what are one or two of your top resources that you think would be really helpful to medical professionals? And then where can they go to access your resources?
Right. So in addition to the education that we've been talking about, we do have a Research Reveals series, and those are recorded and they're available on demand. And so when we're thinking evidence-based, that's something too that you can access that. And I think my last thing would be that we do have healing websites, both for loss after miscarriage and loss after abortion. So miscarriagehurts.com, and then also yourabortionexperience.com. And I mention that because they're available 24/7. Studies have shown how important that is. And also that in a time of chaos, actually being able to do self-directed, deciding what I'm going to go on the website, how long I'm going to stay on the website, what type of activities I'm going to do there, and just knowing that I'm not alone, that those are great resources that are free, that are available for anybody to access.
Wonderful. Wonderful. So for anyone listening, make sure you go to the Institute for Reproductive Grief Care's website. Those links will be in our show notes. And, I would recommend bookmarking those on your phone, maybe even printing out if you're in your office or in your emergency department, printing out those links so that can be part of the resources that are given to patients as well. And I'd really encourage you to go to IRGC's website, check out their resources and utilize them. Michaelene, it has been such an honor and a privilege to have you on this last 2 weeks and just hear about this really innovative and exciting work that you guys are doing.
Well, thank you for this opportunity. And I hope that we'll be engaging with many of your members who, anyway, I just think like their compassion and their drive, these are exactly the type of individuals that we want to be working with.
Absolutely. Absolutely. So thank you, Dr. Fredenburg, and thank you so much to our listeners for joining us today. If you are a medical professional or a student who desires to practice life-affirming medicine, please make sure that you are a part of us. We are here to be a network and a support for you. If you are not a member, you can go to our website, aplog.join and join today. Students and residents are able to join for free, so we encourage you to take advantage of that. If you like this episode, please be sure to give us a like and a subscribe on YouTube, or if you're listening on a podcast app, give us a 5-star review to help boost us to the top of your list. We will see you on our next episode. Thank you so much.